Mr. Richard Lim, Chairman IHES, Mr. Bruce Liang, CEO IHES, Ms. Ngiam Siu Ying, CEO Designate IHES, Mr. Chua Chi Yong, Organizing Chairman of HealthTech X, and Dr. John Halamka, President Mayo Clinic Platform. Distinguished speakers, colleagues, and friends, a very good morning to all of you. I'm delighted to join you today at HealthTech X. I'm glad that we have a very diverse virtual audience: clinicians, care professionals, technologists, scientists, administrators, and students. Today, we gather to learn from one another on how we can harness the vast potential of HealthTech to improve health outcomes and build a future-proof healthcare system. Incorporating technology in healthcare is complex. Not only do we have to consider clinical factors and the patient experience, there are also many systems at play, requiring multiple levels of integration. While COVID-19 has put our healthcare sector to the test, I'm glad that we have managed to develop new technology and data capabilities within a short period to support key pillars of our national strategy against COVID-19. In contact tracing, testing, vaccinations, and running our community care facilities, our HealthTech teams leverage existing solutions and capabilities, quickly adapting them to meet new demands. Last year, IHES repurposed the GP Connect system, a clinical management system originally designed for GP clinics, for deployment at the care facilities. This year, it was repurposed again to support our national vaccination program, enabling 90 partners to run more than 140 vaccination sites. We must also ensure that new technology platforms are flexible enough to enable solutions to scale. One example is the Patient Risk Profile Portal developed by MOH and IHES, which helps GPs assess patients' COVID-19 risk before consultation. Its system flexibility enabled it to be later enhanced for other users, such as a swab referral system, ART for pre-event testing, and even a COVID-19 vaccination module. These achievements could not have been possible without the help of over 150 organizations that partnered us during the crisis. Many stepped up, many stepped forward to offer support in many ways, augmenting our tech workforce, accelerating IT equipment delivery, expediting network services, and offering innovative solutions. On reflection, I have 3 takeaways from our experience in the past 2 years. First, that we have very capable and agile health tech talents with deep clinical expertise and strong technical capabilities. Second, we are fortunate to have a strong digital health foundation with good connectivity in place. And third, we can achieve much when stakeholders collaborate closely to achieve common goals. I thank all our HealthTech professionals, our partners, and IHES for your immense contributions, hard work, and sacrifice in supporting Singapore during COVID-19. Beyond the pandemic, our healthcare system will continue to face new challenges. We must ensure that our systems are future-ready to meet our citizens' health needs. Today, I would like to share 4 beyonds in the context of technology that will support our journey towards a future-ready healthcare system. First, we need to look beyond digitization to digitalization. This has to go beyond shifting from pen and paper to electronic data. It requires a fundamental shift in the way we rethink our processes. Where we can, we should streamline our processes. This may mean using more efficient digital alternatives without compromising quality, reskilling our workforce, and redesigning jobs. This will enable our care professionals to focus on the most important part of their work, direct patient care. Second, we need to look beyond connectivity to continuity of care. This means moving from a multi-agency or multi-services approach to one where we put the patient at the center as they move seamlessly across the continuum of care. The National One Rehab framework builds on this design philosophy, delivering timely rehab across hospitals, primary and community care, using a shared IT solution to harmonize patient outcomes and planning. Different therapists along the care journey will have access to the same information, enabling patients to achieve their goals more seamlessly during care transitions. Third, we need to go beyond one-way to two-way patient engagement and empowerment. One means is through apps that can share health information and engage citizens. I'm glad that our investments in apps like Health Hub, Health 365, and Trace Together have yielded great promise for user engagement, as we have seen its utilization increase significantly. We hope this can become an enabler for two-way engagement where all citizens can proactively manage their health. For example, they can submit their vital signs and wellness indicators for monitoring and analysis, and receive behavioral prompts to improve their health. This also enables clinical decision support for better health outcomes. The fourth is to move beyond retrospective hindsight to predictive insights. By identifying predictive risk indicators, we can more proactively identify population health needs and design timely upstream interventions. This is especially since up to 80% of health outcomes can be influenced by other social determinants. By fusing medical data with other data sources such as genomics, socioeconomic, and lifestyle indicators, we can draw deeper insights to enhance population health. To this end, we have made some inroads through the National Diabetes Dashboard. Through a consolidated database, the dashboard supports data-driven planning at the national and regional health system level. There has also been ongoing work by MOH and IHIS in using this to develop AI predictive models that can identify diabetic patients at risk of kidney failure so that we can intervene early. We'll also make this information available to our primary care practitioners through the National Electronic Health Record System, enabling them to deliver more personalized care to diabetic patients. In the future, we also aim to conduct more longitudinal studies on wellness and efficacy of preventive health interventions and chronic diseases management. In closing, we are living in exciting times where health tech can make a difference in countless lives. There are many more possibilities that we can envisage for the future of healthcare. IHIS has prepared an exciting lineup of local and international speakers over the next 2 days. I'm confident that many new ideas and insights will come up. Let's continue to make a positive impact in solving the challenges ahead, strengthen our spirit of discovery and innovation, and work together to build a future-ready healthcare system for all Singaporeans. Thank you.